Okay. Good morning. Good morning. So we're going to start this off right. Everybody's going to, and again, good morning, everybody. And today is not just another live. Today could literally save someone's life. we talk, we talk a lot about mindset. We talk about discipline. We're going to talk about showing up, but none of that matters if your heart isn't healthy. Heart disease is the #1 killer in America, and many people ignore the early warning signs. Shortness of breath, fatigue, swelling, chest pressures, high blood pressure, we brush it off. So today, this morning, I'm honored to bring someone who works on the front lines of heart failure every single day. Her name is Kenyatta Hicks. She's an RN, Bachelor DSN. She's heart failure clinic coordinator. She's an LVAD nurse. She sees what most people don't. And today she's going to educate us because this isn't about fear, it's about awareness, prevention, and fighting back. So let's get into it. Good morning, Ms. Kenyatta. Can you hear me? Okay, I'm adding her to the stage right now. Good morning.
I cannot hear anything
You
at
can't
all.
hear anything? Let's see. Well, your mic is not muted, and we got you on the stage.
I'm not sure why.
Still cannot hear anything?
Mm-mm.
Excuse me, pardon me, y'all, for technical difficulties, but I'm not understanding why she can't see. Layout, like that. I do not know why it's doing that. Let's see.
Mm-mm.
Okay, so we can, let's see here. Back from the studio, here. Oh, let's see, we already have that. Let's see. Let's see. Is anything on your end saying you're muted? Probably need to hit your, if it's a symbol that says mute or unmute. Please be patient with us, y'all. You're going to enjoy it once she can hear us. Still not saying anything? Okay, let's see here. Media assets. I'm truly
I
not
can't hear.
understanding
It's
what's
just
going on.
nothing. I'm not sure why. I can see
Okay,
you. I see your lips talking, but I can't hear anything.
let's see. See, when I hit mute, I unmute your mic. It says mute. Right? Can you hear me now?
Mm.
How about now? Still nothing? Okay, let's see. Okay. Oh, can you hear anything we're saying now? Can you hear anything now? Still can't hear? I do apologize, y'all. How about now? Nothing? I can. Oh, wow. I am just flabbergasted. I don't know what's going on. But I unmute my mic. Let me see. Okay, we'll see if we can bring her to the studio. And please forgive me. If nothing else, we'll have to call her in. Let's see. Okay. We're going to bring her in. Let's try it again. Okay. Okay.
I can hear you now.
Can you hear me now?
Yes.
Awesome. Awesome. Forgive me, everyone. So, welcome as we have introduced you. And not only just she's my family, my niece, I'm just very proud of her, but she's doing something that, especially this month, but she does it every day. So,
Yes.
first, I want to give you is, can you explain your role as a heart failure clinic coordinator and LVAD nurse?
So I would say my role, I help patients navigate through like some of the hardest seasons in their life. As a LVAD nurse, I actually take care of the patient after they have had their LVAD implanted. So I do the nurse visits for LVADs and for heart failure patients as well. So my main goal is I do a lot of problem shooting or troubleshooting for the equipment. Um, if they have any driveline infections, they need any dressing changes. Um, I'm just here to like basically troubleshoot anything that's going wrong. And I also do injections and I draw labs. Yes.
Okay. So, what exactly is heart failure in the arena where you are? What would that?
Okay, so heart failure is basically when the heart is too weak or too stiff to pump blood effectively through the body. It doesn't mean like the heart is not working at all. It's just like it's just too weak to do what the body needs it to do. So you'll see your classic signs of shortness of breath. Uh, you'll see swelling, and a lot of people have come in saying they're just not feeling like themselves, and they don't even know they have heart failure at all until all the labs are done and everything.
Wow.
Mhm.
So, and as the next question I have is, what is an LVAD? What is an LVAD, and when does someone need one?
So an LVAD stands for left ventricle assistance device. It helps the body. I mean, it helps the heart that is very weak pump and do its job efficiently throughout the body. Um, so the person will determine, well, our staff will determine if a person is a candidate for a heart transplant or if they're just on long term therapy, meaning that the LVAD will be their heart permanently. Some people they are. I saw like since I've been there the last 2.5 years, I've seen several LVADs be candidates for hearts. They do great. They keep moving. Whereas some people are candidates and they do not want a heart. They're just like the LVAD is fine. I'm fine. I want to keep it and keep moving.
It's
Yep.
very interesting. Very interesting. All right. So, as you know, I'm sure you know this, that we're in Women's Heart Health Awareness this month of
Mhm.
February. And the question
Yes.
we have is, why is heart disease the leading cause of death in women?
I'm gonna say it's because women's symptoms often show up differently, um, and sometimes they're just misdiagnosed, which is very, very common. And like I stated before, some women don't even know they have heart failure. And it can be due to like lifestyle, stress, hormonal changes that are, that play a big and huge part in women having heart failure. And it just being a silent killer. Most women are just, well, I'm not gonna say trained, but are raised to, oh, let me just push through. I gotta keep pushing through. And they're
Uh,
pushing through and just feeling really bad and just never go and get checked until the last minute.
and I've seen they played the commercials this month here on television showing that they're doing reenactments of what women go through, and it's like, oh, I'm just feeling a little tired. Let me take a moment,
Hmm.
and really in the middle of it, they're actually having a heart attack.
Yes, which is
So
crazy.
the other question is, are heart attack symptoms different in women as compared to men?
I'm gonna say, me personally, I'm gonna say there isn't a difference. You might have someone may have a different symptom, but just like the normal heart attack symptoms are jaw pain, back pain, nausea, feeling very fatigued, feeling like something just isn't right. I know a lot of people have swelling in their feet, heart palpitations, just being tired all the time. And I know
Mm.
I get a lot of um, women also tell me they feel like something is just sitting on their chest, and they have
Oh,
that sensation is that heavy feeling on their chest that just can't let up. Hmm.
okay. So, and I guess it segues into it. What are the warning signs women often ignore?
I'm gonna say the warning signs that they often ignore. The tingling in the right arm. I just had that just the other day. One lady said she was having it for weeks and she was just ignoring it. Um, she said she was feeling tired all the time. Also, she was telling me she was having swelling in her lower ankles, in her feet, and also in the abdomen. She was just saying,
Yes.
maybe I'm bloated. She kept, trying to, maybe I'm bloated, maybe I'm bloated. Um, and we ended up doing tests. She ended up having fluid on the heart, and it was just
Ooh.
like a whole thing.
Hope you all are listening. Send this out to someone who probably needs to hear it. But our next question is, at what age should women begin prioritizing heart health?
I would say we need to start as soon as possible. There is no age that is too early. I would say maybe start in your early 20s, 20s and 30s. Those are like your golden years. Those are very important. Why? Because now I'm like going in the process of making sure, because I'm 33, of getting going to my doctor's appointment and make sure I'm getting my tests when it comes to my hormones. Shout out
Yeah.
to my uncle man. Yes. Um, Yes, so we just need to make sure you're just staying on top of those things. Like I said, especially when it comes to stress, um, pregnancy related complications can happen, high blood pressure, and also family history is very and very important. So you need to like know all those things about yourself and your family.
Okay. So the next question we have, and again, send this to someone who probably needs to hear this. And the question goes at, what are the three daily habits that protect heart health?
I'm gonna say three three habits would be, I would say, move your body every day, even if it's 20 minutes, 10 minutes, 15 minutes. Make sure you're moving. We need that movement. We need that activity that the heart needs every day. I'm going to stay hydrated and eat real food with less salt. Cause we have all this processed food now. And you just want to make sure you're just eating something real. Just like my uncle taught me, it can be a sweet potato, it can be some lean ground beef and a veggie. Just keep it simple. Just stay away from the salt. And I would say my third thing is to manage your stress. If that requires meditation, if that requires just having a quiet time for 15 minutes. Or some people like to pray, you know.
So do you think of all those three you just named, do you think stress plays a huge part in that affect the
I'm
person
gonna
that?
say yes. Stress does. Stress plays a huge part in it. Yes, very much so.
Okay. So
Mm.
how important how important is sleep for cardiovascular health?
Oh, I'm gonna say sleep is very, very important, which is crazy because I just had this patient the other day.
Uh,
Um, she was not getting any sleep. She was complaining of still having palpitations, still having like heart flutters. I ran all the tests. I did an EKG. We got labs, and everything checked out fine. But as we continued to talk to her, she was telling us she was continue to still take Ativan or to take little supplements to help her sleep. And that's not a normal sleep pattern at all. Those things force you to go to sleep. So you're not getting that actual sleep that the body needs to
Rest.
repair itself and the heart needs to repair itself.
Oh wow.
Yes.
Okay. Those, and again, you all like share this to someone because I'm sure somebody, we all know somebody that may need to hear this. Uh, how does strength training and regular movement benefit women's heart health?
I'm gonna say it lowers the blood pressure, it controls your blood sugar, and also it helps build muscle, also supports weight management and help you feel more confident again. Just doing little stuff like that helps strengthen the core, helps support you to have stronger legs, and it's giving your heart stronger and blood flow what it needs to be stronger. Like that stuff is very, very important.
So it's not just about, exercises is not just about, losing weight or getting
Hmm.
in shape, but it helps because of the health benefits of it, especially for your heart.
Yes. Hmm.
All right. And when we have here, is there a connection between emotional stress and heart conditions?
I'm gonna say, yes. Um, just because the different emotions. Um,
Mhm.
let your heart listen to when it comes to trauma, when it comes to anxiety, when it comes to grief. Um, those things are just consistent
Yeah,
because you're always in survival mode, which triggers the heart. Yeah, so that's very important. And it can cause, physical changes in the heart. So I would say we need to, stay very protective of the heart as much as we can, because that's a very delicate muscle that we definitely need.
now I know you see men and women, but this is especially Heart Health Month for women. What would you tell women who constantly put themselves last?
I'm gonna say that you can't pour from an empty cup at
Ooh,
all. Yes, you just can't do it. So if you're sitting here trying to give everyone your last, your last, your last, what else is in your cup to give out? We need to focus on your health. You need to focus on the present and just basically, focus on staying alive, because those things can physically be exhausting and wear you down over time. So you need to actually take care of yourself. And like I said, just take a moment to meditate, to pray, just to have that quiet for time for 15 minutes by yourself. That's
yeah,
very important, because if the cup is empty, you know, how can you fill someone else's glass?
that is true. That is true.
Mm.
And the other question we have, and again, I hope you all are tuning in because this is very, when we say heart of the matter,
Yep.
we mean that literally. So, what is the one thing you wish every woman understood about protecting their heart?
I'm gonna say your signs will give you signs. I mean, your heart will give you signs before you become in trouble. Um, don't ignore your body. Make sure you know yourself. Um, and protection isn't being selfish. It's powerful. So make sure you're actually being more aware to your body. Make sure you're being more in tune to your body, so you don't ignore those signs. And you know when you get to the hospital, it's too late. We don't want
Yeah,
that. We want to try to catch it as soon as possible. So like I said, just make sure you're being more in tune with yourself and knowing those trigger signs and when something is not right.
awesome. So I have these rapid fire. This is part of the segment here, and I'm not sure whether you get asked this, but I'm sure you guys may. Uh, and if a person say, uh, "Can I drink coffee or tea? Which is better?" Or
I had a I had a patient ask me that the other day. Honestly, I'm gonna say both, because you don't want the caffeine. As long as there is not any caffeine. So we try to stay away from caffeine as much as possible here at the heart clinic, just because we don't want that rapid sensation. We don't want any palpitations. Um, um, and I know a lot of my nurses, they drink coffee. So now it's heart month, exactly. So
yeah.
we've been drinking teas, we've been drinking green teas, we've been doing less caffeine. Um,
Oh, okay.
yes.
So
And I
this is like a
Mhm.
group thing, a togetherness thing that you all are doing.
Yes.
Okay. So this question here is cardio or strength training?
I'm definitely gonna say strength. Cardio is cute, but muscles protect the whole body. Just being honest.
Y'all hear that? All right. The next question, and I'm not, and again, these may be some things that you're asked, or they ask the doctor, and you're in line of being aware of that. Walk or run?
Definitely walk. It's more therapeutic, it's more grounding, and it's actually more sustainable. Let's
Okay.
just think about it.
Okay. So here's the what's worse for the heart, chronic stress or sugar? Did I lose you? Can you hear me? Hello? Hello? Can you hear me? Oh, we were just getting really good at this. Okay. See if that helps with bringing it back in. It's not the internet. But either way, I mean, we want her to answer these questions, and you all who've been tuned into this segment, we're gonna try to bring her back to the stage. I don't know what's going on. Let's see. Uh, let me see. Okay. We need to pause for a second and bring her out because this is very important, and hope that she gets this and you guys understand it. So I'm sending her another invite to bring her back on. Can you hear me now?
Yes.
Okay. All
I'm not
right.
sure what happened. Sorry, guys. It just blacked out.
All right. So the other question would be, what is worse for the heart, chronic stress or sugar?
I'm gonna say definitely chronic stress. Your body can recover from a cupcake, but not from but not from years of just carrying the world on your
Okay.
back. Chronic stress is definitely a silent killer. Yes.
If you had to say one word women need to hear today.
I'm gonna say my one word would be deserving. I'm also gonna say rest, love, care, and peace are all those words are very important. You need to, just rekindle yourself, re reevaluate and be with yourself as one. And really just take care of yourself. It's really, really important. When you start to see those signs, don't be scared. We're here. Um, and honestly, working at the heart hospital is just has been incredible for my many years being there. It's different than just the regular hospital. At the bedside, you'll see everyone there holding patients' hands, being there with you, so you're never alone. And we're always here. Yes.
So, what would be the biggest thing? I mean, you've been in this and you've seen the good, the bad, and the ugly. But from the standpoint of a person, and I wonder if you run into this, are most compliant or it begins to be a struggle at times?
Um, I'm gonna say I see the best of both worlds. I see a lot of people being uncompliant, but I also see a lot of people trying. Um, Whereas, like I said, some people they're just like, you know what, this is what it is. I'm gonna still, continue to live my life and do those bad things that got me here. Um, which is kind of unfortunate, I know,
Yes.
which is kind of unfortunate because they think we're able just to keep fixing them and fixing them and fixing them. And sometimes we just
Wow.
can't.
So, and I'll give part of this, and this is part of the closing message. And one of the things I'm going to say is protect your heart, schedule your checkup, move your body, protect your peace, just like Nurse Hicks said. And I encourage you, if you all feel encouraged, if you feel encouraged, type heart in the comments. And if you're committed to
Mhm.
especially if you're committed to prioritizing your health, heart health. Now, and as I say, I know you've seen the good, the bad, and the ugly. Well, what would be your message that you send out to anybody's listening, men or women?
I would say my message, please, please, please take care of yourself. Don't ignore those signs. Um, do your normal checkups. Do your normal. Make sure you go see the dentist as well. That's very important. A lot
Oh,
of people have yes, a lot of people have coming in because teeth. Um, your teeth are very important. Those dental cavities lead to the heart, which can cause heart failure.
wow,
Yes.
that
I
is
didn't know that until I became a nurse. Yeah.
so. You all have had people come in that may have had a dental situation in their mouth, but they may not have known it, and you have
Yes.
made them aware of that they may need to go to their dentist and get
Yep.
treatment.
Yep. Because before any procedure, any heart procedure, they're gonna consult with the dentist and make sure everything is right like it's supposed to be. I know all like I hate to say rotten, but like rotten teeth, brutal teeth, teeth that may have an infection or just doesn't look right, they're gonna extract. They're taking them out because a bad tooth can cause an infection down into your heart.
I hope that
Yes.
resonates with everybody. I mean, make me feel like I set my dinner point earlier now. But but I hope this resonates with y'all. And Nurse Hicks, I really do thank you for your time, because I
You're
know
welcome.
you're busy during the week, and the weekends you want to be able to group, bring yourself back to normal. And of course,
Yes.
if nobody knows this, I do meet at the gym, so she practices what she preaches. So
Yes.
I do want to thank you. And I know you've already gave your closing remarks, but is there anything else you like to say to the audience? And so hopefully it resonates with them, because this is a serious topic.
Yes, you guys come in if you have any questions, if you know anyone that is in heart failure, that needs help, that needs, support, we are here. We have from doctors, we have all the way down to social workers that can help you, and we're here.
To navigate this.
We Yes, I'm located at Prisma Health. I'm down at the Advanced Heart Health Clinic. Yes, come see us. My name is Kenyatta. Just ask for us. We'll get you a consult and we'll take care of you. Yes.
All right. I really appreciate your time. As your uncle, I love you. As your profession, I'm just above the moon. Very proud of you, and thank you for taking time to be with us.
Oh, you're welcome, guys.
All right, darling. Take care.
All right. Bye.
Okay. All right, guys. You hear that? And before we end this, and I'm just reading out because I had to print this out. And I want to say something directly to the women watching. Your heart is not just a muscle. It carries stress. It carries pressure. It carries responsibility. And too often, you carry everyone else's before yourself. Your heart is not selfish. Your heart checkup is not optional. Your life matters. Well, and in today's conversation, if today's conversation helped you, and don't just watch this, share it. Because protecting your heart is protecting your future. We want to thank Nurse Hicks for educating us. And to everyone watching, take this seriously. We'll see you the next time. And as I always tell you all, if not you, then who? If not now, then when? Y'all take care of yourselves, but most of all, take care of each other.